I'm here today with a good friend and colleague, Dr. Jace Wolfe. He is the Director of Audiology and Research at Hearts for Hearing in Oklahoma City. And welcome, Jace. I'm glad you're here, and but I think it's important that you tell us a little bit about Hearts for Hearing.
Okay, well, thank you, Dr. Caraway. I work at Hearts for Hearing. It's a nonprofit speech and hearing center in Oklahoma City. Our mission is to maximize the opportunity for children and adults with hearing loss to listen and talk for a lifetime.
That is terrific. And so that's exactly why we're here today, because one of the questions I think that I get all the time, and I think you probably get all the time, is how in the world do you test a baby's hearing?
Well, that's a great question. We have really advanced technology that allows us to really accurately evaluate a child's hearing and with a high level of certainty estimate how much hearing loss they might have if they have hearing loss or whether they have normal hearing. The primary test that we use is called an ABR test, or an auditory brainstem response. And everybody has probably seen the measures or tests that are done where we tape wires to somebody's head and we read their brain waves with those wires. And that's essentially what an auditory brainstem response is. We're reading brain waves that are produced by the brainstem, by brain cells or neurons that respond to sound. We place tiny earphones in the baby's ears. We can play low pitch sounds like bass notes, middle pitch or high pitch sounds like treble notes. We can adjust the volume level of those sounds, and we can see how the brain waves change. And when there's a response, there's a really characteristic shape of the brain wave response so that we can tell that the child is likely hearing that sound. If there's no response, then typically we have a flat line indicating the child is likely not hearing that sound. And what research has shown is that we can typically estimate for the majority of children within 10 decibels their hearing thresholds.
Wow. So it's really a great science that pediatric audiologists use. And so, like, how old can you do that with a baby? How old do they have to be?
We routinely evaluate babies' hearing with auditory brainstem response test in the first week or two of life at Hearts for Hearing.
Wow. So you can find out very early, identify babies with hearing loss and diagnose them. But are there other tools and resources that you use in that diagnostic appointment or that diagnostic evaluation?
There are. A good test of a baby's hearing should include a battery of tests. It should include several tests. So the ABR test is always the backbone of that battery of tests. That's the one that gives us the best estimate of a baby's hearing. But also, otoacoustic emission test should always be completed as well. The otoacoustic emission test evaluates the hair cells in the ear that help us hear soft sounds. If those responses, the otoacoustic emission response, if it's absent and middle ear function is normal, then that suggests that there's a problem in the cochlea and there's at least a mild hearing loss. Okay. Another really important series of tests to do are middle ear measurements. Most families are probably familiar with the tympanogram or tympanometry that evaluates how the eardrum moves. If there's fluid behind the eardrum like you might have with an ear infection, we can identify that and determine if middle ear function is abnormal and might influence the results of the otoacoustic emission or ABR test. And then another really important test is what's called an acoustic reflex test. There's a tiny little muscle in the middle ear that will contract to sounds that are loud but not uncomfortable. Right. And that can also tell us about not only cochlear function and cochlear nerve function, but middle ear function as well. And really all those tests should be done to evaluate the auditory system.
Yeah, so it's wonderful that we have that today, and it's amazing because we know that little babies are learners from day one, and every single day babies need access to sound and the language around them so that that little brain can grow and they can develop listening and spoken language just like a typical or a normal hearing baby.
You're exactly right, and we can, like I said, we can estimate where the hearing loss is across the pitch range, and the great thing about that is then that allows us to really accurately fit hearing aids. Hearing aids are really high tech today. They have digital signal processing, and there's essentially an equalizer in the hearing aid that allows us to adjust the volume or the output level of the hearing aid in each individual pitch or frequency range. So if we know what the hearing loss looks like across the pitch range, then we can fit hearing aids, and even in spite of the hearing loss, we can make sound audible. We can give children access to sound through hearing aids that are programmed specifically for the child's hearing needs.
Yeah, so it really becomes very individualized, customized, specific. You have to understand the hearing loss of the baby, and then it's fitting the appropriate technology to provide access to all the sounds of speech.
That's exactly right.